You're Amanda from StraightSmile Solutions, and today we're going to continue our series talking about dental and orthodontic conditions that can be monitored with photography and videography. And if you've read some of my other blog posts, you know I'm a huge advocate for capturing records every time your patient comes in the chair for either a new patient visit or a recall visit, because there's so many conditions and symptoms that can be monitored with photography and videography. And we are partnering, StraightSmile Solutions is partnering with Dental Photography Made Easy to help you make sure that you're capturing this in an accurate manner. But today we're specifically going to be talking about abfractions. And this is kind of a big word. It's a word that most lay people are not familiar with. But you can see here in this picture, you see how the enamel is notched out, right? Especially on this tooth right here. For the most part, this kind of wedge of enamel pops out because of an imbalanced bite, grinding teeth. And you can see here, this patient's bite is not balanced at all. There's a lot of attrition as well. We talked about attrition or tooth wear at the tops of the teeth, like right here, okay? But there's also abfractions, which is that wedge-shaped piece of enamel that popped out as a result of a bad bite and grinding. And once this starts to happen, it's a very progressive disease. You can get fillings, but they're going to keep popping out and getting bigger. You're going to need a root canal later. You might lose that tooth, lose many teeth, and need a very expensive full mouth rehab on your teeth or even dentures. So it's really important when your patient shows signs of an improper bite or improper malocclusion that you don't just say it's okay. You need to treat it. And even if the patient says, no, I don't want braces, I don't want aligners, I don't want to treat this, I'm fine. It is your job as a dentist to explain to this patient the risks, benefits, and alternatives of a condition like this. And you don't just do it once. You do it every time they come in. That's why I love dental photography, to document conditions like this. Because you take it now, say it's February, and then you take it when they come back in August, and then you take them again and have that discussion, not in a pushy way, but just in a doctor way, every 6 months. And later, if something becomes more progressive, you've basically done what I call CYA, which is cover your beep. Because you've done your part. If the patient is refusing treatment, at least they refused it and you've documented that you informed them the risks, benefits, and alternatives of doing so. So there can never be an adequate litigation against you that you didn't do your job as a doctor. And you know what? Photos are so much more powerful than words in charting. And you can train all your assistants, and my friend Bill with Dental Photography Made Easy can help you with the scripting on this, but it's just so easy to implement and just kind of make it standard operating procedure in your practice. And this is just one of 23 different conditions that I say that you can easily monitor, many of which are orthodontic related. Not all, but all right, anyways, you get the idea. So don't forget to go to StraightSmileSolutions.com, subscribe, become a client. You're welcome to chit chat. I'm happy to chat with any dentist out there if they'd like suggestions on scaling ortho in their practice, making their practice more efficient. I also will help you with that. It's a complimentary consultation. Every dentist in the whole world is welcome to schedule that 20-minute appointment. Also, please do subscribe to our YouTube channel. There's a ton of helpful information in there to help you scale your practice. That's all free. YouTube is free. It's just content that I make for you. I love your suggestions on content too, so feel free to ping me and let me know what you think you'd like to learn about. Don't forget to join our various forums on Facebook, both doctor-facing and patient-facing, for information in the dental world. And remember, I'm all about clear, I'm all about removable, and I'm all about healthy.